Module 4, Chapter 26, Crisis and Disaster. Objectives: analyze a critical or crucial time in your life in terms of your perception of the event, situational support, and coping mechanisms. Identify 3 types of crisis: maturational, situational, and adventitious, and provide an example of each. Crisis characteristics: disturbance caused by a stressful event or a threat. It disrupts an individual's homeostasis or equilibrium. Normal coping mechanisms fail and results in the inability to function as usual. The equilibrium is displaced by disequilibrium. Successful crisis outcome. Factors are realistic perception of the event, adequate situational supports, adequate coping mechanisms. A case study is Mr. and Mrs. Alexandro are devastated when a faulty ceiling fan causes an electrical fire in their home. Last Wednesday, they came home from dinner with friends to find that not only was their house destroyed, but their cat Alfie was missing. He hasn't been seen since. Insurance is paying for their temporary stay in a tiny apartment for now, but Mr. Alexandro tells you that the place just adds to my wife's depression. I can't get her to do anything with me, not even take a walk, which she usually makes me do. We do go out to the old neighborhood every day, look for Alfie, and we're starting to lose hope for him. We're going to talk about crisis theory. Eric Linderman had a behavioral responses to crisis or normal. That was his thought. General Kaplan outlined intervention strategies grounded in homeostasis and equilibrium, how to keep everything going, status quo. And Albert R. Roberts created 7-stage models of interventions. Types of crisis. Maturational, which is new development stage is reached, old coping skills no longer effective and leads to increased tension and anxiety. Situational arise from events that are extraordinary, external, and often unanticipated. Examples of this are like a loss of a job or a changing of jobs, a death, change in financial or marital status, or psychiatric or physical illness. Adventitious crisis. Some of them can be natural, which are like epidemics, like the pandemic, floods, fires, and earthquakes. Human can be one-on-one violence, acts of terrorism, wars, riots, shootings, and bombings. Just think back to the World Trade Center and 9/11. Accidental could be like an airline crash, structural collapses, nuclear power plant failures, and things like that. Phases of crisis. Phase 1, serious stressor or a problem results in increased anxiety. This stimulates the usual coping mechanisms and defense mechanisms in an effort to address the problem and decrease anxiety. In phase 2, defense mechanisms fail, so the threat persists. Anxiety increases, producing feelings of extreme discomfort. Functioning becomes disorganized and trial and error attempts at problem solving begin. In phase 3, you've got trial and error attempts fail. Anxiety can escalate to severe or panic level. Autonomic relief behaviors mobilize, like withdrawal or flight. And some forms of resolution may be devised, like compromising needs or redefining the situation. In phase 4, problem is unsolved and coping skills are ineffective. Anxiety overwhelms a person and can lead to serious personality disorganization, depression, confusion, violence against others, and suicidal behavior. So Mr. Alexandro returns to the clinic 10 days later, bringing his wife with him, though she is resentful. "I don't want this," she says. "Why can't people just leave me alone?" Mr. Alexandro does most of the talking as his wife is clearly withdrawn. He talks about things he has done to try to cheer both of them up, but everything's failed. Ellie's withdrawing from everyone. She's so depressed. And me, I'm a basket case because I'm afraid we're never going to recover from this. Last week I was driving to the grocery store when I had to pull over because I couldn't breathe. I think it's my first ever panic attack. During therapy, the nurse and Mr. Alexandro proposed to move to a nicer, larger apartment while they wait for insurance to begin the process of helping them build a new home. "There's that new complex near the park where we used to walk," Mr. Alexandro says. "We could walk the trails there like we used to without having to drive so far. There's a fitness center and even yoga, and when you're ready, we can think about adopting a cat." "I'm not ready to replace Alfie," his wife says, but after a moment she softens and says, "I'm sorry, Robert. Those new apartments by the park, though, I'd like to see those." Which phase best describes how the Alexandros are doing right now? Phase 1, phase 2, phase 3, or phase 4? Possibly B, but more like C. Although identifying these phases are seldom completely cut and dried, you're correct in choosing either phase 2 or phase 3, though phase 3 is more likely. Trial and error has failed, and while Mrs. Alexandro uses withdrawal as a coping mechanism, her husband is trying to figure out a different plan. Application of the nursing process. Identify at least 2 nursing diagnoses that have relevance to individuals who are experiencing a crisis. Provide concrete examples of interventions to minimize crisis situations. Compare and contrast the differences among primary, secondary, and tertiary prevention and identify appropriate intervention strategies. List at least 5 resources in the community that could be used as referrals for a client in crisis. Application of nursing process assessment. You need to do a general assessment of your patients or of your clients. Perception of precipitating event. What you think brought them to this point. Situational supports. Coping skills. How did they manage the crisis that they're in? And you have to do a self-assessment so that you don't bring crisis in your life into your solution for someone else. nursing diagnoses, risk for impaired coping, risk for or actual impaired family coping, risk for or actual impaired community coping, and anxiety. And then you've got to have outcome identification. What do you want to see happen? Your planning, how are you going to help your clients out to sort through this emotional point of crisis? Implementation, you want to make sure your patients are in a place or your clients are in a place of safety. Anxiety reduction, an appropriate level of prevention and debriefing and evaluation after you have gone through the case. Levels of prevention. Primary prevention promotes mental health and reduces mental illness to decrease the incident of crisis. Secondary prevention is intervention during an acute crisis to prevent prolonged anxiety. And tertiary prevention provides long-term support for those who have experienced a crisis. Critical incident stress debriefing, a tertiary prevention tool like 7-phase group meetings. Examples are debrief the staff on the inpatient unit following a patient or a client suicide. Debrief school children and school personnel after a school shooting, debriefing rescue and healthcare workers who have responded to a natural disaster. Treatment modalities would be emergency room. That's not the ideal place. Behavioral crisis care services like crisis call lines, warm lines where someone's there to actually talk to someone, crisis intervention teams, and crisis stabilization facilities. Similar to crisis hotlines, warm lines provide confidential telephone support, but unlike crisis hotlines, warm lines are not designed for crisis situations, but to prevent escalation of distress. Psychiatric advance directive plans. Usually advance directives are used in end-of-life situations in psychiatry. These plans take the form of a document that is developed by the consumer to be used in crisis situations where the consumer is unable to make decisions. This proactively addressing a crisis situation before it occurs. Stipulations wishes to treatment choices, treatment facilities, providers, and designated support person to be involved in the decision making. A single parent has just lost her job and calls the warm line in her community. This is an example of A, tertiary prevention, B, primary prevention, C, secondary prevention, or D, critical incident stress debriefing. The answer is C, secondary prevention. Secondary prevention establishes intervention during an acute crisis to prevent prolonged anxiety from diminishing personal effectiveness and personality organization. After safety issues have been addressed the nurse works with the client to assess the client's problem, support systems, and coping styles. Desired goals are explored and the interventions planned. Disaster response. Objectives are to recognize disaster occurrences and management of global concerns. Describe the potential roles of nurses in disaster situations. Global disasters, large-scale crises, examples like tsunamis, hurricanes, wildfires, large-scale depletion of natural resources, international stock exchange collapses, and pandemics. Um, Disaster preparedness, or to develop resilient communities, assess disaster risk on a local level, extend to networking communities, extend to large societal and national programs. Disaster response, FEMA's four-phase disaster management continuum is mitigation, preparedness, response, and recovery. The Department of Homeland Security, civilian first responders at a local emergency response professionals, created the National Incident Management System. The National Incident Management Systems, NIMS, coordinates first responders and incident command system training. The Department of Homeland Security coordinates United States responses to U.S. disasters, ultimate responsibility for U.S. safety, assure immediate availability of preparedness, response, and recovery protocols, use civilian first response professionals, and created national incident management systems to coordinate efforts between responders and agencies. A Category 5 hurricane destroys homes and businesses in the community. How would this crisis be classified? A, accidental, B, situational, C, adventitious, or D, maturational? C, a natural disaster like a hurricane is a type of adventitious crisis. The term adventitious comes from the Latin term adventitus, meaning coming from outside, and advere, meaning chance happening. An adventitious crisis, then, is a traumatic and external event that happens unexpectedly. This type of crisis may be natural, human, or accidental. Natural disasters may be the result of such events as epidemics, floods, fires, and earthquakes.